Hello, my name is Jasmine and I'm a student at St. Martin's, and today I will be demonstrating how to insert a urinary catheter into a patient with female genitalia. So I saw in my patient Esther Bailey's health record that she is currently experiencing some urinary incontinence and that she has an order for an indwelling catheter to help relieve that. And I did already look at the health record to see that she has no allergies, but we will again confirm that in the room. So I have all my materials here for the sterile procedure, which is as ordered. And we're gonna get started right after we introduce ourselves and tell her a little about the procedure. So let's head on in. Hand hygiene. Hello, Miss Esther Bailey. How are you today? Good. Okay, glad to hear it. Do you mind if before I start talking, I check your name and date of birth, just to confirm? Okay. All right. Thank you. I'm gonna check the name tag. So my name is Jasmine. I'm a student at St. Martin's. I'm gonna be your nurse today. And I saw in your health record that you are experiencing some urinary incontinence. I know that you said you were good, but are you feeling any pain? Right here. Yeah, okay, I'm sorry to hear that, but hopefully the procedure today will help alleviate that for you. Have you ever had a urinary catheter in before? No? Okay. So I'm just going to let you know that unfortunately the procedure is pretty invasive, but because of your urinary retention, it's unfortunately something that we just have to do today. And a little tube is going to go in through your urethra into your bladder and kind of help suck out like all the urine that's being trapped in there. Okay? All right. So, as long as you're okay with that, we'll get started. Okay, and just before we start, I'm going to let you know that having in a indwelling catheter does put you at risk for a hospital-acquired UTI, but we will try and keep the area as clean as possible so that that doesn't happen. And we're going to try and keep the procedure as clean as possible, which is why it is a sterile procedure. So, can I ask if you have any allergies? No allergies to latex, iodine, shellfish? No? That's great to hear. All right, that's a little high. All right. So, quickly, before we start, I'm going to don some clean gloves. Actually, no, let me do hand hygiene again first. All right, gonna don some clean gloves, and we're gonna assess your perineal area to make sure that there's no reason we can't put the catheter in today, okay? So before I uncover you, we did provide privacy, curtains closed. And like I said earlier, this is a sterile procedure, so it would be great if you moved as little as possible during the procedure. Right now is okay. And I did hear that you already had perineal care done, so we don't have to do that today. All right, so I'm going to assess the perineal area here. Gently look between the labia, see if there's any signs of redness or swelling, and I don't see any, which is good. So there should be no reason that the catheter cannot go in. All right, do you mind helping me into like an open leg frog position? All right, thank you so much. That looks great. So we're gonna leave you uncovered here, okay, while I get my materials ready. And just try not to move, okay? All right, take off my gloves.
Good morning, Mr. Scott. My name is Becca. I am from St. Martin University. And I came here
I'm gonna take out my kit.
give you
Use it as a trash can.
I know the person has a little procedure. You say you have
Put it right here.
rating 6 out of 10. So I'm gonna give you some IV medication, which is morphine sulfate, and it's going to help with lowering of pain post surgery. And this medication can give you
the box is inside the 1-inch parameter. I can see that. And so we're gonna take on my gloves here.
Something or get out of the bed, let us know. And if you feel anything aside from what I mentioned, let us know.
Before we start, I'm gonna put on my sterile gloves.
So, can you
it is backwards.
confirm your name and date of birth? Okay. So, do you have any allergies? Allergy to iodine? or any skin antiseptics? No? Okay, alright. I'm gonna prepare. I'm gonna keep hand hygiene here really quick. Which one do you prefer? Yeah? This one? Alright.
All right.
I'm gonna put a hand
So-
on you so that I can check your
Now I can grab this.
veins.
All right, we're gonna keep sterile procedure. Not gonna touch anywhere that isn't sterile. All right, I'm gonna move my box, orient it to the side,
Okay.
still within the 1-inch parameter.
I'm gonna go over here.
All right,
You ready?
gonna take out my wet swabs.
Alright.
Let's put this over here first.
Going to do my hand hygiene too.
All right. There we are. All right, just gonna let that sit in there.
Good. The privacy is already
Alright.
provided. Over here.
So,
Vigorously.
all right, I'm gonna start cleaning.
I'm gonna wait for it to dry.
All right,
As I
actually, before I start cleaning,
prepare my stuff.
I'm gonna prepare this
Hygiene again.
so that it's easier. All right, now I'm gonna clean. All right, so I'm gonna do this without touching the. I'm gonna wipe up. Another wipe up the side, and then one up the middle.
Please 30 seconds.
All right. So now we're gonna take this whole thing.
Same.
All right. Now I'm gonna establish this as my dirty hand, and we're gonna stabilize. All right, we're gonna push it in, making sure not to touch. All right, that should be far enough. All right, so sterile is done. So we're gonna drop this.
I will write the name, initials.
All right. Now I am able to take off my gloves.
And the gauge I have is 22 gauge. Okay, that's it. Ready to go.
Okay. No longer sterile, so we're just gonna throw everything willy-nilly.
The back in. Now to
Oh my goodness.
is getting okay.
All right, I'm gonna take all this. I'm gonna make sure to tape this
I will
to the side of the leg
touch
so that the patient can still move around freely without worrying about pulling out the catheter. Oh my goodness, I forgot one thing. Let's, all right, good. So, now that that's done, I can push aside all my materials. All right, how did that feel? Not too bad? Okay, glad to hear it. So, we're gonna pretend it's taped already. I'm gonna put the bag down at the side of the bed and hook it onto the side. All right. So, I'm gonna cover you up, okay? You can move back into a comfortable position. And just as some general patient teaching before I leave today, please do not remove the catheter on your own, like do not take it out by yourself, because you have risk of damaging your urethral tissue. And if you ever feel any burning or itching down there, you ever notice any redness or swelling, please let us know immediately. And I will be back soon to assess how you tolerated the procedure. And I will keep track of your urinary output, and I will document that now that we're outside the room. So like I said, we're gonna document urinary output. We're gonna come back and assess that the patient tolerated the procedure well. We're gonna document that. And then we're gonna document that the procedure was done, and that we did patient teaching. So that should be everything.